Hello, Miss Christine. So we are here, me, Melati Firta Sutrieko Santoso, and my friend, Christina Mentari Mangansige. We are here to present our review result for a paper titled Heart Failure Patient Survival Analysis with Multi-Kernel Support Vector Machine. Here are the outlines, which started in introduction, then related work, then methodology, experiment and result, and then ended in conclusions.
Healthcare monitoring frameworks empower persistent observing on patients' medical issues by detecting supposition on their body symptoms, such as internal health level. Heart failure is a medically complex disease where the heart can not pump sufficiently, which is depicted by shortness of breath and some other conditions, as demonstrated by the European Society Cardiology. 3,600 adults are late investigated for the disease, which then remained as a miserable failure for the past 5 years. They are a past model of risk for HF sufferers that were often restricted to left ventricular ejection fraction. An opportunity was then created to create a prognostic model in HF patients with reduced and average EF. Cardiologists then evaluate some estimates to appear that a final clinical understanding, given the section characteristic of a patient and many clinical histories. There are more than 500 estimates obtained for the echo, yet they are time restricted to translation that potentially are not recognized in flow clinical practice. Learning atau ML can help solve these hurdles by providing automated analysis of large clinical datasets. Even so, these are typically limited to take some various features as is given the propensity to overeat small datasets. As a solution, nonlinear machine learning would have a superior accuracy over differentiated and direct mortality models that utilizing all estimations would outfit unparalleled desire, exactness, differentiation, standard clinical data, and specialist itemized left ventricular ejection fraction. The main contribution of this paper are correlation-based and ranking-based methods are used as two selection methods. For selecting the best feature, the correlation-based method apply correlation-based feature selection (CVS), while the ranking-based use information gain ratio engineer index. For feature selection on both methods, MKSVM classifiers are used to predict the survival rate and rank the corresponding feature to the most critical risk factors. The decision of treatment based on the patient's conditions could be substituted with this system guidance.
Now, we are moving to methodology proposed. To provide a practical system, the selection of attributes based on their importance using two approaches, which are MS and CFS-BFS, along with algorithms, the usage machine learning algorithm, are important. This picture, which is figure 1, is the scheme or the theme of working of heart failure prediction system. Okay, so first, we're going to talk about the feature selection. This step was done to minimize overfitting, which leads to two conditions, which are a more enhanced accuracy, which means less misleading information, and less training time, which means the fewer complexities of the algorithm brings to having a smaller number of time spent on the algorithm training. Moving on, we're going to talk about two attribute selection. The first one is scoring method. The calculated score are used to access the worth or value of the feature based on the classification task, which then plays a vital part in determining the class label's value. So there are three scoring methods, which is the first one is information gate. This quantifies the decrease in entropy by parting a dataset as indicated by a given estimation of an arbitrary variable. So the P here denotes probability, which is an entropy function in the equality here, or the formula here. The second one is gain ratio. Considering the number of branches that would result before during the split or considering the inherent data of a split. The third one, we have Gini index. It is also known as Gini impurity. It computes the probability of a specific feature that is classified wrongly when selected arbitrability. The P on the formula represents the probability of a feature being classified for a distinct class in this equation. Now moving on, we're going still to talk about the scoring method. By applying the method, here are the best three attributes selected to optimize the CA and training model in the HF or heart failure prediction system. So among the nine features that we had, which started from H, as we can see, H, enemy, creatinine, etc. Here are the three best features that are got from the scoring method. Now moving on to the CFS and BFS. AS or attribute selection holds two parts which consist of CFS, which stands for correlation-based feature selection, as the attribute evaluator, and BFS, which stands for the best first search as the search method. The CFS procedure acknowledged the unessential features despite the estimation should neglect a low association with the class and in this way. On the other hand, the involving features have typical relationship regarding features class name and is the ordinary among two features. Best first close search use full training set option and target as death event which then selected out some attributes with which can be shown in the second table. Now, moving on to dataset descriptions. The data was taken from the available dataset in the UCI ML repository that is primarily populated on 2017 and updated on January 2020. There are 299 instances with 12 features values act as the deciding factor of the disease in case of HP condition. The 9 feature values can be seen on the picture also. Age is mentioned in years. Anemia is mentioned in Boolean. High blood pressure is mentioned in Boolean also. Creatinine phosphokinase or CPK is mentioned in mcg per liter. Diabetes mentioned in Boolean. Ejection fraction mentioned in percentage. Platelets mentioned in kiloplatelets per milliliter. Sex mentioned in binary. Serum creatinine mentioned in mg per dl. Serum sodium mentioned in EQ per liter. Smoking mentioned in Boolean. Time mentioned in days. And lastly, death event mentioned as the class table. Now, we're moving on to the multi-kernel support vector machine. SVM or support vector machine is a supervised AI model that utilizes order calculations for two-bunch grouping issues and classifying new contents. Its computation figure out a hyperplane in an n-dimension area which have various sorts, such as these four equations that we're seeing right now. The first one is linear kernel SVM, which also which also shows with the function. And the second one is polynomial kernel. The third one is RBF SVM or Gaussian support vector machine. And the last one is sigmoid or sigmoid SVM. Okay, now we're moving on to the experiment result. So here are shown the confusion matrix. Confusion matrix represent achieving the target compared to actual and predicted values. The left one we can see from the SM calculation, and the right one is from the CVS calculations. The red box shows instances that are misqualified, while the gray boxes shows the correct instances. So we can see from the left part first, the figure 2, which is CM for SVM linear, it has 204 instances are correctly classified and 59 instances are misqualified. In polynomial SVM, it has 259 correctly classified and 40 misclassified instances. In the fourth figure, it has 250 instances are correctly classified, whereas 449 misclassified instances are there. In the fifth figure, sigmoid SVM, 246 instances are correctly classified, but 53 instances are wrongly classified. In the linear SVM model for the CFS, as shown is in figure 7, 239 instances are correctly classified and 60 instances are misclassified. The polynomial SVM model, as shown in figure 8, have 249 correctly classified instances, followed by 50 misclassifications. Similarly, in figure 9, SVM RBF has 250 correct classified instances, followed by 49 misclassified instances. And in figure 10, sigmoid SVM has 250 instances are correctly classified, with 49 misclassified cases. Moving on, here we can see experiment result that is shown in ROC plot. The left side is from scoring method and the right side is from CFS. ROC plot demonstrate a classifier's trade-off among true positivities and false negatives. Map sensitivity that provides insight into actual positive cases predicted by the model correctly. Now moving on to the last comparison between SM and CFS. Comparing both the AS or attribute selection with the classifier models, as mentioned in the table 3, provides the insight that SM is showing good accuracy results. In the case of SM, the classifier model SVM or RBF and sigmoid gives good accuracy, and in the case of CVS, BFS, SVM polynomial, so overall, the SVM method is advisable. Based on the dataset and approaches used, the results are varying. And Figure 12 presents the CA comparison between SM and CFS-BFS methods.
Conclusion. The use of multi-kernel supports vector machine MKSVM is effective in predicting the survival of patients with heart failure. The model achieved an accuracy of 88.3% in predicting the survival of heart failure patients. The inclusion of multiple kernels in the SVM model improved the accuracy of survival prediction compared to using a single kernel. The study used three different kernels: radial, basis function, RBF, linear, and polynomial kernels. The study found that age, ejection fraction, serum creatinine, and serum sodium level are important prediction of survival in heart failure patients. This factor can be used to improve patient outcomes by identifying high-risk patients who require closer monitoring and more aggressive treatment. The results of the study suggest that MKSVM can be valuable tool in clinical decision-making for a heart failure patients. By accurately predicting patient outcomes, healthcare providers can be informed decision about treatment options, including the use of implantable devices and cardiac transplantation. Overall, the study provides evidence that MKS-SVM is a promising tool for predicting survival in heart failure. Patients can be used to improve patients' outcomes. However, further research is needed to validate the results of this study and to investigate the generalizability of these findings to other patient populations.
Lastly, we're going to talk about the advantage and the disadvantage of the journal that we're talking about. So this journal succeed in explaining the whole research well and clearly. The explanation given to the methodology and experiment was detailed. Diagrams are indeed made to be easily understood for readers. For the disadvantage, too much construction of keywords are used in the explanation, which kind of bothering us as a reader, as we have to relook for what do the word stands for in the previous pages. Okay, so that is all for our paper review assignments. Thank you for listening and bye-bye.